Hello, my name is Kristen Prelip, and I'm the Public Information Officer and Communications Manager for the Orange County Health Department. Welcome to the fourth episode of Public Health Chat. In each episode, we will meet some of the wonderful people who work in public health and will explore a variety of topics. Today, we will discuss mental health resources during this difficult time, as well as give an update on the COVID-19 vaccination process. We are joined today by the Orange County Health Director, Quintana Stewart, Rebecca Crawford, and Denise Blanco Duran. Quintana, if you would, please give us a COVID-19 update for Orange County, North Carolina.
Sure. So as of today, we have a total of 5,839 lab confirmed cases of COVID-19 here in Orange County. Over the past 7 days, we've had 452 new cases. This means we're averaging about 65 new cases each day. This is among the highest number of cases we've seen since the pandemic began back in March. As of today, we've unfortunately also had 68 total COVID-related deaths. Looking at some of our key metrics for the county, the data shows us we are definitely seeing a surge as a result of gatherings and travel that occurred over the holidays. Case count has consistently increased over the past 2 weeks. Our percent positive of all tests conducted has also increased. As of test data through January 5th, our percent positive is now 8%. This is well above the goal of 5% or less. Our hospitals continue to see significant visits in the ED for COVID-like illness, and hospitalization for COVID cases continues to be high. Last week, Governor Cooper extended Executive Order 181, which outlines a modified stay-at-home order requiring everyone to stay at home between 10 p.m. and 5 a.m. The order also requires many businesses and activities to close or suspend operations between 10 p.m. and 5 a.m. Alcohol sales are also prohibited between 9 p.m. and 7 a.m. On January 6th, Secretary Mandy Cohen issued a secretarial directive directing all North Carolinians to only leave home for essential activities such as work, school, healthcare purposes, to care for family members, or to buy food. Avoid leaving home if you are over 65 or at high risk for developing serious illness. Avoid gathering with people who do not live with you. Wear a mask and keep distance from people when you leave home. Avoid any indoor public spaces where people are not wearing masks, and stay away from crowds. Avoid places where people may gather in large numbers. There's been recent reports in the media about variant strains of COVID-19 deriving from the United Kingdom and South Africa. It appears the mutated strands are more contagious, but does not seem to make people more ill. At this time, there is no confirmed case of the new strand here in North Carolina. State lab is testing for the new strand and monitoring. The existing vaccines don't appear to be any less effective against the new mutations, although they may need to be tweaked in the future. This is evident that we need to double down and continue to practice the 3 W's. Wear the mask, wait 6 feet apart, and wash your hands often. Even after vaccination, everyone will need to continue to practice the 3 W's. Our numbers aren't great right now, but they could be worse. We can still turn things around and suppress this virus in our community. So I want to say thank you for all your hard work, and I beg of you, please keep it up. You know, as our former emergency services director, Ms. Dinah Jeffries once used to always say, this was her mantra, each passing day gets us one day closer to the end of this pandemic. So again, I say thank you, residents of Orange County, for all the hard work, and I implore you to keep it up. We can beat this.
Thank you for that update. Now, let's discuss mental health in the times of COVID. Denise, thank you so much for joining us today. This year has been very difficult for many community members. Many are experiencing heightened levels of stress due to the pandemic, racial violence, the elections, as well as uncertainty about the future. If you would, please let viewers know what your title is and a little bit about the work that you do here at the Orange County Health Department.
Thanks for inviting me to this conversation, Kristen. I'm a clinical social worker at the health department. I mostly offer behavioral health support to pregnant women participating in our OB Care Manager program, as well as families in the CC4C Care Manager program. My support mainly consists of conducting short-term therapy with patients. I also help coordinate other mental health services like psychiatric evaluations and medication management when needed.
Many people have a difficult time keeping their spirits up in winter. This effect has been compounded by pandemic fatigue and unrest in our country. What are some things we can all do to combat winter depression, also called seasonal affective disorder?
Yes, technically, seasonal affective disorder is a form of major depression, and it can be quite serious. The most effective treatment for depression has three components: talk therapy, medication, and natural mood support. Natural mood support is a big category that includes things like vitamin supplements, nutrition, being outside, exercising, as well as positive social support, like engaging in creative activities and spiritual practices. Sometimes by adjusting some of these natural mood supports, people might be able to manage depression symptoms. However, I want to emphasize that if someone is having suicidal thoughts, self-harming, if they are having a hard time to the point that they're not able to do their daily activities, such as showing up for work or fulfilling family commitments, getting out of bed, taking care of personal hygienes, or taking care of pets. In these instances, people should seek medical help.
Okay. Can you offer up a simple plan that community members can follow to combat depression, especially during winter?
Sure. So here's a 5-point winter depression plan. So the first one is consider taking vitamin D supplements. Sunlight can be short during the winter months, and our bodies don't store vitamin D. So try to check with your primary care doctor about taking vitamin D. See a therapist. A therapist can help you train your brain to think more positively, which can also make you feel better both physically and emotionally. And remember, if someone is experiencing one or some of the severe symptoms I mentioned before, they should seek medical help right away. Look at nutrition. Winter comfort foods are fine in moderation. It is important to remember that good nutrition makes a positive difference to your mental health. Complex carbohydrates such as whole grains can boost your energy. Fruits and veggies of deep green or orange color, like broccoli, kale, and carrots, have nutrients that promote better mood and total health. Exercise outdoors when possible. It's getting darker earlier, and getting outside when the sun is out can be difficult, especially if you're attending to different commitments such as work and/or children. So it's important to remain intentional about getting some outdoor moving time. So consider a brisk walk while the sun is still up, at lunch, or take a lap around the parking lot when you arrive at work, or even when you go to the grocery store. Nurture your spirit. There are things about winter you can enjoy. Make a list of activities or holidays you can look forward to this winter and put them on the calendar. Slow down and curl up in a cozy chair with a good book or write in your journal. Watch a funny movie or call a friend. Studies have shown that even just 5 minutes a day of engaging in a nurturing activity can reduce stress.
Denise, that is so helpful. As you know, one's mental health is intricately connected to and is just as important as their physical health. If someone would like to get help or find a therapist, what would you recommend?
People can reach out to us at the health department at 919-245-2400. Either we will be able to work with you and to offer free short-term therapy, or connect you to other agencies and programs in the area where you can access services. People with insurance can also call their health insurance provider and ask for a list of in-network therapists. And again, if you're experiencing more severe symptoms or you feel unsafe, or you're in unsafe situations, you can contact different service providers for support. We have for domestic violence, you can call the Compass Center at 919-929-7122. For sexual violence, you can call the Orange County Rape Crisis Center at 1-866-935-4783, and the Suicide Prevention Hotline, 1-800-273-8255.
Denise, do you have any last comments you would like to share?
Yes, I want to remind people that depression is a common condition worldwide. And in the last year, and still, there have been some factors such as the pandemic and political turmoil that are affecting our well-being. So it's completely normal if you're experiencing emotional and mental health struggles. I can guarantee that you're not the only one, and that struggling is sometimes a sign of your ability to care and to have empathy. So I hope that people can take this into account and practice self-compassion and reach out for support when needed.
Thank you so much. Thanks for all that you do and for this important information. Now we will turn to speak with Rebecca Crawford. Rebecca, you were on our very first public health chat, but would you remind us of what is your title and what kind of work do you do here at the Orange County Health Department?
I'm Rebecca Crawford, and I'm the Finance Director for the Health Department. I'm also coordinating our COVID-19 mass vaccination plan in Orange County.
Since our last public health chat, the Orange County Health Department has vaccinated over 1,300 people. Can you tell us how to sign up?
We continue to vaccinate healthcare workers and people living in long-term care facilities from the 1A phase, but yes, we are now scheduling appointments for and vaccinating anyone age 75 and older. You can sign up for an appointment 2 different ways. Option 1 is completely online and is a 3-step process. First, you would complete our vaccine interest form, and that link is on our vaccine webpage, which is orangecountync.gov/get-your-shot. The next step would be our staff will then send you a link to register in the COVID-19 vaccine management system, which we call CVMS. We are dependent upon the state system, and this may take a few days to receive that link because of the large number of requests they are receiving. And finally, you will then receive an email from us with instructions for how to schedule an appointment for your vaccine. Our second option, which you can use if you need help at any time, not just if you would like to call, you can also, if you get through the online process and need help, make sure to call this number too. But that number is 919-913-8088, and our staff will help you to get registered and scheduled for an appointment over the phone. We have foreign language interpreters available to help those that don't speak English or don't speak it fluently. I will say that we are experiencing a very high call volume, so please be prepared to leave a voicemail, and someone will return your call very soon, but it may not be on the same day you call. If you are not in one of the current phases, we ask that you wait to register or call our number until it is your phase, so we can make sure to register everyone in the current phase as quickly as possible. Eventually, the CVMS system will allow residents to register themselves. Until then, we'll post on our website when we are in each phase, and you can also find that information on the North Carolina Department of Health and Human Services website.
Thank you. So if I live in Orange County, is the Orange County Health Department the only option to get the vaccine?
Definitely not. UNC Health is also offering vaccinations right now for 1A and for 1B. You can visit their website, which is vaccine.unchealthcare.org, or call 984-215-5485 to register. They are also experiencing large call volumes, so please expect a longer than normal wait time. And it may be faster to schedule online with UNC Health than to call that number. Orange County Health Department and UNC Health are separate, even though we are great partners. So we ask that people do not double book appointments, meaning please go either through UNC Health or the health department to sign up for your vaccine.
So Quintana, can you tell us who is next in line to be vaccinated?
As we heard earlier this week, federal government has some new recommendations about the priority groups, and they wanted to open up the phases a bit to include additional folks not, categorizing their first run of it. And so this morning I just learned, and bear with me because I, again, am trying to take it all in. So we are now moving to 5 comprehensive phases. So no longer do we have phase 1, 1A, 1B, group 1, group 2. We now have 5 phases. And so we'll start with the first phase. So phase 1 now includes all healthcare workers, long-term care facilities, residents, and staff. And so that's a little different from the first phase 1A group that we had. It was only for those that were directly treating COVID-positive patients, but now we are lumping all healthcare workers into phase 1. Phase 2 now includes all older adults, 65 and up. So regardless of medical condition, and it's all older adults in phase 2. So we are actively now vaccinating group 1 and group 2. Then phase 3 will be all of our frontline essential workers. Phase 4 will be adults at high risk for exposure and increased risk of severe illness. And then phase 5, we open it up to everyone else.
Thank you. Rebecca, how do you think the vaccination effort is going?
Really well. We have had so many volunteers from the county and from our community, and they have been crucial to help us vaccinate those 1,300 people that you mentioned. We'll continue to hold multiple mass vaccination sites per week until everyone is vaccinated.
So our last very important public health question for all of you is, now that we finally made it to 2021, do you have a New Year's resolution for this year? Quintana, I'm going to pick on you first.
Wow. Yeah. So I think my New Year's resolution would be, I don't know, maybe to get more sleep. I will say I have not been a good steward in watching my health and taking care of myself. And Denise's talk today, kind of stepped on my toes, with nutrition and stuff. So I think one thing I can do in 2021 is to really turn it off and get an adequate amount of sleep so that I am prepared to show up and serve the residents of Orange County each day.
Thank you. How about you, Rebecca?
Mine is also influenced by Denise's comments. My resolution is to spend more time outside at our vaccination sites and less time inside at my computer.
And how about you, Denise?
Well, kudos to Quintana and Rebecca for those for those resolution. Mine will be supporting more local and small businesses. That's something important to me, and I've been doing it, increasingly doing it more and more. So I want to keep doing it even more this year.
That's a great resolution. Well, I'm going to take a cue from Denise. Mine is going to be to put self-care at the top of my priority list this year in 2021. All right. Well, I want to thank each of you all for your hard work during this pandemic, for your leadership, and for participating in this public health chat today. Stay safe and healthy, everyone. Bye.